If your unborn baby has fluid in its kidney, the worst thing you can do right now isn't ignoring it, it's Googling it. Because within 3 minutes, you'll be falsely convinced your child needs surgery. Let me explain what's actually happening and what you should do instead. When Stephanie was 35 weeks pregnant, she went in for a routine ultrasound. She was excited to see her baby boy one last time before delivery. But the ultrasound tech went quiet. Then she left the room to get the radiologist. The radiologist pointed to a dark spot on the screen. "There's fluid in your baby's kidney," she said. "We call it hydronephrosis." Stephanie's heart dropped. She'd never heard that word before. She immediately searched for information online, and within minutes, she was convinced her baby would need surgery, or lose a kidney, or worse. Today, I'm going to tell you what happened to Stephanie's son, Asher, because his story reveals something that almost every parent gets wrong about this diagnosis. And what I'm about to share could save your child from years of unnecessary fear, repeated testing, and even major surgery. Here's what most parents don't realize. Hydronephrosis shows up in about 1 to 5% of all pregnancies. That's incredibly common. If you're watching this right now, there's a good chance you or someone you love just heard these words during a prenatal visit. "We found fluid in your baby's kidney." And I know exactly what's happening in your mind right now. You're terrified. You're confused. You've probably already read 10 different articles that gave you 10 different answers. Some say it resolves on its own. Others talk about surgery. And the worst part? Nobody is telling you what this actually means for your child's future. Let me be very clear. Pediatric urologists have treated hundreds of children with this exact condition. And the biggest mistake parents make isn't ignoring the problem. It's the opposite. They panic. They push for interventions the child doesn't need. Or they live in constant anxiety, convinced something terrible is about to happen. Today, we're going to fix that. By the end of this video, you will know exactly what hydronephrosis is, why it happens, which cases actually need treatment, and the one question you must ask your doctor at your next appointment. But first, let me tell you what happened to Asher. Asher was born healthy. He was a beautiful baby boy. The doctors monitored his kidneys with ultrasounds every few months, and everything seemed stable. The fluid was still there, but it wasn't getting worse. Stephanie was told, "We'll just watch it." Then, when Asher was 5 years old, something terrifying happened. He woke up screaming in pain. He described it as a terrible side ache. He started vomiting. Stephanie rushed him to the emergency room. But by the time a doctor saw him, the pain had completely disappeared. Asher was fine, laughing, playing, like nothing had happened. The doctors were confused. They suspected appendicitis, then dietary issues, then anxiety, then constipation. This went on for years. Stephanie would watch her son double over in agony, rush him to the doctor, and then nothing. The pain would vanish. No one could explain it. Here's what was actually happening inside Asher's body. And this is the part every parent needs to understand. The kidney produces urine, which normally flows down a thin tube called the ureter into the bladder. In some children, the connection between the ureter and the kidney is too narrow. Urine backs up. The kidney swells. That's hydronephrosis. But in Asher's case, something else was happening. The obstruction wasn't severe enough to cause constant problems. It was intermittent. His kidney would swell, cause excruciating pain, and then, for reasons doctors didn't initially understand, the urine would suddenly pass through. The pain would stop, and every test would come back normal. For years, Stephanie was made to feel like she was overreacting, like her son's pain wasn't real, until they finally found a pediatric urologist who did something different. She believed the pattern. She ordered a specialized test that revealed polyps inside Asher's ureter. Small growths that were creating a valve-like blockage. When the polyps shifted, urine passed. When they didn't, the kidney swelled. The mystery was solved, but the solution was major surgery. Now let me translate what was happening to Asher into the science every parent needs to know. There are actually 2 types of hydronephrosis seen in unborn babies and children. This is the first thing every parent should understand. Type 1, physiological hydronephrosis. This is the common one. It's temporary. It happens because the baby's urinary system is still maturing, and sometimes the ureter is a little floppy or the bladder doesn't empty completely. In the vast majority of cases, 80 to 90%, this resolves on its own within the first year of life. No surgery, no medication, just monitoring. Type 2. Pathological hydronephrosis. This is what Asher had. There's an actual physical blockage. Something is preventing urine from flowing properly. This could be a narrow ureter, a blood vessel crossing in the wrong place, polyps like Asher had, or a condition called ureteropelvic junction obstruction, UPJ obstruction. Here's the key difference, and this is what you need to discuss with your child's doctor. The grade of hydronephrosis. Medical guidelines grade it from 1 to 4 based on how much the kidney is swollen. Grade 1 and 2, this is mild. The kidney is slightly swollen, but function is almost always normal. These cases almost never need surgery. Monitoring with ultrasounds is usually enough. Grade 3, this is moderate. There's more significant swelling, and the kidney may start to show early signs of stress. Some of these cases need surgery, but many can still be managed with careful observation. Grade 4, this is severe. The kidney is significantly swollen, and there may be thinning of the kidney tissue. These cases often require surgical correction to prevent permanent damage. But here's what most parents don't realize, and this is critical. The grade alone doesn't tell the whole story. A child can have a grade 4 hydronephrosis that never causes symptoms and never damages the kidney. And another child can have a grade 2 that causes intermittent severe pain like Asher's. If you're a parent hearing all this for the first time, your head might be spinning. Grades. Types. Surgery or no surgery. It's overwhelming. So if you could take a moment right now, in the comments below, tell me, what's the one question about your child's diagnosis that keeps you up at night? Your question might help another parent who feels just as lost as you do right now. Let me give you something practical you can use today. Whether you're pregnant and just got that ultrasound report, or your child has been living with hydronephrosis for years, here are 5 evidence-based steps that pediatric urology guidelines recommend. Number 1. Ask for the grade. If your child's doctor hasn't told you whether the hydronephrosis is grade 1, 2, 3, or 4, ask. This is the most basic piece of information, and it guides the entire treatment plan. Number 2. Ask about kidney function. The grade tells you about swelling, but what really matters is whether the kidney is working properly. A nuclear medicine scan called a MAGI-3 scan can measure how well each kidney is functioning. If both kidneys are functioning normally, even with swelling, that's a very reassuring sign. Number 3. Don't ignore pain, but don't panic either. If your child has hydronephrosis and starts having episodes of severe flank or abdominal pain with vomiting, that's significant. This could be something called Diethel's crisis, intermittent obstruction like Asher had. Document it. Take notes on when it happens and how long it lasts. This information is valuable for the medical team. Number 4. Know the red flags. If your child develops a fever with flank pain, that could signal an infected hydronephrosis, which requires urgent medical attention. If your child has visible blood in the urine, persistent nausea and vomiting, or is not growing as expected, these are reasons to seek prompt medical evaluation. Number 5. Find a pediatric urologist you trust. Not all hydronephrosis cases are the same. Not all doctors approach it identically. You want someone who sees this condition regularly and can give you a clear, evidence-based plan, whether that's observation or surgery. Let me tell you how Asher's story ended, because I think you need to hear this part. Asher had the surgery. The surgeon removed the damaged portion of his ureter with the polyps and reconnected it to his kidney. The recovery was challenging. He needed a stent, and there was post-operative pain. But his mom, Stephanie, said something important. She said the hardest part wasn't the surgery itself. It was the years of not knowing. The years of watching her son suffer and having doctors dismiss her concerns. The years of wondering if she was overreacting, if it was all in her head. She said the guilt of not having answers sooner was heavier than the diagnosis itself. After the surgery, Asher recovered. Today, he's an active, joyful boy. He has regular checkups to monitor his kidney, but he's doing great. Here's what to take away from Asher's story. Most children with hydronephrosis will never need surgery. Most will go on to live completely normal, healthy lives. The condition often resolves on its own. Even in severe cases, modern pediatric urology has effective tools, minimally invasive techniques, robotic-assisted procedures that can fix the problem with minimal scarring and excellent long-term outcomes. But the emotional toll on parents? That's real. The anxiety, the uncertainty, the fear that you'll miss something, that your child will suffer because you didn't act fast enough. Hear this clearly. Asking questions does not mean you're failing your child. Seeking answers does not mean you're overreacting, and you are not alone in this. If you remember only one thing from this video, let it be this. Hydronephrosis is common. It's manageable. And in the vast majority of cases, children do very well. But you deserve clear answers. You deserve a medical team that explains the grade, checks the function, and gives you a plan. This channel exists because every parent deserves to understand their child's health, without the medical jargon, without the fear-mongering, and without being dismissed. Next, watch the video on your screen right now. It covers the exact difference between mild and severe hydronephrosis and the specific questions to ask at your first pediatric urology appointment. Thank you for watching. See you in the next video.